I'm Lucy Bentley from Lucy Bentley Yoga. Thank you for joining me today. So this is a prenatal yoga practice for sciatica pain in particular. So obviously with the pressure of baby growing, it can put some added pressure onto your sciatic nerve, and that can cause quite a lot of pain. So this is a really nice class to relieve it. As with all my classes, please always consult a physician, a doctor before you start, just to get the go ahead and the all clear. This can be also done if you are pregnant, so postnatally, as well as, if you're not pregnant at all, that's totally fine. Just making sure that before you start, you have a blanket. We're going to be rolling this up as well, or you can have a scatter cushion, small pillow, something like that. So we'll just put this aside for now. And then to start off the practice, we will come into a wide leg child's pose. So that's bringing the big toes to touch. The knees are as wide as the mat. I'm going to sink down onto the heels. So you're trying to reach those sit bones down onto the heels, and the arms are stretched out in front. So fingertips spread wide. The pads of the fingers are pressing firmly into the mat, and the forearms are lifted up. And then you're going to drop the forehead onto the mat. Now, if you are further along in your pregnancy, so your third trimester, I would advise you to maybe get a maternity pillow or anything like that, or use a rolled up blanket if you want, just to relieve that pressure of the belly. So you can always pop it underneath you, lift it up here onto the belly, or perhaps pop it underneath the forehead if that helps. And just settling into this moment before we start our flow. Starting to bring awareness into the breath, breathing in through the back of the throat, down through the back of the spine, expanding through the rib cage, and then into the sacrum and the hips. And as you exhale out, try to imagine your hands pushing into the mat and pushing away from the sit bones, which will then leave you to push back onto the heels. So inhaling, expanding through rib cage, sit bone. Exhaling, sinking further onto the sit bone, onto the heels, and the arms are pulling away. So the arms are active here. Relax through the face and the shoulders. Taking 2 more conscious breaths. And start to notice where your mind is at today. Start to notice if you perhaps have any tight spots in the body, or any things that need to become unstuck. On your final breath, exhale out, lifting yourself up slowly into a tabletop. So if you have any props, just moving them to the side for now. And then coming into your tabletop position, so your knees are hip-width distance apart, your toes are untouched, and your fingertips are spread wide. So you're keeping that action in the hands that you had previously in your child's pose. The wrists are directly under the shoulders, setting up here. So this is neutral spine. Navel is slightly lifted towards the spine, and the tailbone is tucked under. Taking a breath in. Inhale, dropping the belly, broaden through the collarbones, looking up. So pushing the floor away with the tops of the feet. And on your exhale out, bringing the chin to the chest and pushing the floor away, dome in the upper back. Inhale, dropping the navel, looking forward. Exhale, rounding the back, push the floor away, so you're really active in the top of the body. That's good. So keep doing these in your own breath. We're starting to lubricate and warm up through the spine. And if you want, you can start rolling out in the sit bones and the hips. Perhaps swaying side to side and shutting down the eyes. So you're coming into your body now, coming into the practice, and starting to notice if there are any spots that are perhaps need a little bit of extra love, and perhaps pausing there and then just ironing it out. So again, if you are in your third trimester here, when we come into our downward facing dog in our flow, please just come back into this cat-cow and dropping the navel, looking up and rounding the back. So anytime we're in down dog, come into your cat-cow. Last breath here, and back to center to tabletop. So if you are third trimester, stay in cat-cows, otherwise extending the fingers slightly in front of you, so perhaps a fist distance away. We're going to come into our down dog. So just making sure that your middle fingers are pointing directly to the center of the mat. That is where your hands should be placed. And again, jazz hands, so fingertips spread really wide. Tucking those toes under, taking a breath, and then exhaling out, lifting those sit bones back through to the back of the room, to the up, to the top, and exhaling out to down dog. Lifting that navel through the spine, perhaps starting to pedal out your dog. Just warming up through the back of the body here. And again, like I said, if this is too much, coming back into your cat-cow. Otherwise, bringing stillness, letting the head drop. Imagine your thumbs are magnetizing towards each other, so that's starting to engage the tricep. Relax the neck and the shoulders, and then lengthen even further up towards the ceiling on the sit bone. And then if you want, bend your knees as much as you need here, and imagine your outer ankles are hugging in towards the middle. For 2 more breaths. And on your last breath, bringing the feet a little bit wider than the hips, and then slowly walking your hands back to your feet. So bend the knees, make room for babies. Obviously, if your feet need to come wider than that, that's totally fine. Bend the knees as much as you need. Place the forearms on tops of the thighs, so just above the knee. This is your forward fold variation. Drop the head, and then start shifting the weight left to right. Chin is tucked, really starting to open up through the hips, and still keeping a fairly flat back here. So trying not to round the back too much. We're straightening and we're lengthening through the front and the heart. And then coming to stillness, placing the hands on tops of the knees and then rolling up vertebrae by vertebrae to the top. Reaching the arms overhead on your inhalation, hands to heart center, exhale out. Placing your hands onto your baby, just taking a moment here, just to arrive and to bring some awareness into your baby, into the womb. And then opening up the eyes again. So we're going to start our practice now. So for our sciatica. So coming into the middle of your mat, so you've got some extra room, what we're going to do is we're going to sink down into a chair pose. So we've got a wide leg chair here, so hip width distance apart. Reaching the arms up overhead, sinking low into the knees as if you're sitting onto a chair. This is Utkatasana. Again, really great for strengthening the legs for childbirth. Tuck that tailbone under, reach the arms overhead. And then we're going to sink lower on your exhale. Good job. Lift the toes a little bit. Try not to arch too much in the lower back. Relieve that pressure there. Reaching up. Breathe. Exhale. Back to center. Good. This time, as we reach the arms up overhead, inhale. Exhale, pressing that right leg over the top of the left thigh, sinking down. So we're coming into a figure 4 shape. If you're a bit wobbly, always use something to place your hand on and then sinking into the leg. So you can use the wall or a chair. I will face you so you can just see this figure 4. Keep your balance. Find a spot on the floor And keep that right foot flexed. You want to protect that knee joint. Lift away from the hip crease. So you don't want to fold forward too much. You want to lift up and away. Sink into that leg, and if you want a bit more, reach the arms up. Otherwise, keep the hands here onto the leg or onto the hips. Sink a little lower, breathe, keep breathing. One more breath. And then exhale, extending that right leg back. That wasn't elegant what I did, so I'll just do it again. Extending that right leg back, so you're now in a stand. Place the hands onto the hips, point the toes, and then start pulsing that right leg back. Good, so you're squeezing that right butt cheek, starting to strengthen through the glutes. And when you're doing this, you want to keep those hips squared off, okay? So try not to arch to the right-hand side. You want to square off to the front. Good job. Almost there. For 4, for 3, micro bend in that knee, for 1, and dropping down. So that back foot comes down into a triangle pose. So the feet are hip-width distance, the feet are slightly apart. You maybe want to step out a little bit further if your bump will get in the way, just to have some more balance as well. Reach the arms overhead. Exhale to open the hands and place them onto the hips. Exhale, bending forward into your pyramid pose. Flat back, really draw the navel in and bring those shoulder blades towards each other. Tuck the chin. And then if you can, reach down that left leg, and if you can, dropping the hands. Don't worry if you can't, just leave the hands where they are. You should feel a lovely stretch there behind the left hamstring. Try to square off the hips here. So try to bring that left hip inward slightly. Good job. Drop the head if you can. 2 more breaths. Last breath in. And then exhale to climb back up. Place the hands onto the hips and use the strength of your legs to lift yourself back up. Good job. So you'll be rotating to the right hand side of the room so that the toes are pointing to either corner of the mat, okay? So I'm going to face you for this. So they're pointing to either side of the mat. We're coming into goddess pose. We're going to soften through the knees, so bend through, nice and low, sink the hips, and then reach the arms overhead. On an inhale, exhale, cactus the arms, and then open up through that heart space. So you're bringing the elbows towards the back. Sink nice and low in those knees, and put an imaginary string pulling around the kneecaps and pulling you backwards. So you're opening up through those hips. And smile. We're not here for too long. Keep breathing, keep squeezing. For 2, for 1. Inhale, reach up nice and tall. Beautiful. So I'll just face to where I was. You're going to just open up back into your pyramid pose again. Reach the arms round to the hips and step that left foot to join the right. So we come back to the top of the mat. Feet are slightly wider than the hips. Breath into it. Reach up nice and tall. Exhale. Hands come down and forearms on top of the knees. And then bring the hands down onto the mat, coming through into your tabletop, drop the knees. Everyone here, baby push-up, so you're bringing those elbows in towards you, so triceps, dropping down for 2, for 1. Good job. One leg child's pose, exhale, sink low in the hips. And then drop the head here and just start to notice if there's been any opening, if there's been a shift, if you can feel a difference in the hip space. Exhale, breath out. And then inhale back into our tabletop. So just grabbing your pillow or your blanket that you had and placing it to the side of the mat at the back of your mat. And then placing the hands back into your tabletop position. So cat-cow, dropping the belly, looking forward, rounding the back to center. Moving the hands forward, okay, so if you're third trimester, stay in cat-cow, otherwise breath in, exhale to down dog. Good job. So we're going to do 2 breaths here.
See if you can release anything, any unwanted energy. And then bringing the feet a little bit wider, walking the hands back, using that core, drop the head. And then just slowly placing the forearms onto the tops of the thighs, rolling through the hips for our forward fold, dropping the head if you need. And then slowly rolling your way up. Reach your arms overhead. Hands to heart center. So you know where we're going this time. So we're going to put the left leg over the top of the right, this time flexing that foot. So I'll just face you. You stay where you are at the back of your mat. That left leg extends up and over that right. Oh, sorry. We're doing a very important thing first. Grabbing your pillow. Grabbing your pillow and placing it in between the thighs. All right, so this is going to be your use to squeeze your legs together so that you're working internally here. And this is a great way to strengthen through the thigh space before labor as well. So we're coming into our chair pose as we were before. Squeeze nice and tight, reach the arms overhead. Inhale and exhale to sink low. Squeeze, squeeze, squeeze. You may need to bring your feet in slightly. So just show you from the side. And then the navel towards the spine, tilt that bowl, tilt that fruit bowl underneath your pelvic floor, lifts, sink lower. Breathe. And exhale back up to stand. Can you feel that squeeze in between the legs? That's the sensation that you want to keep when you are in your poses in your practice. So removing that blanket for now, and then now coming in to the other pose. So I'll face you. Reaching the arms up, inhale. Exhale, bring that left leg over, flexing that left foot. If you want, you can place the hands on the hips or bring yourself to a wall. And then exhale to sink into that right knee this time, keeping that left foot flexed. Keep the shoulders away from the ears. Breathe. If you want, you can use that left hand to open up that hip even more. Good job. Lift away from the hip crease. For one more breath. Good job. And then exhale, left foot extends back. And we're going to pulse through that left foot. So again, if you want, hand on the hips. And left leg to pulse for 5, 4, squeeze that butt cheek, 2, 1. Step that left foot back, coming into pyramid pose. So again, if you need to shift that foot a little bit to the right, just make sure that your feet are parallel to your mat. And then if you need to widen the stance or shorten it, please do. Bring that tilt towards the front. Reach the arms up overhead. Exhale to open up the arms and then placing on the hips to hinge forward. Flat back extends. Pause here. Good job. Micro bend in the knee. Try not to lock out there. Bring those elbows back. And then if you want more, you can place the hands down by the ankle or dropping them to the mat. Really, it doesn't matter where you are. You should be feeling this lovely stretch in the front of the leg. And then drop the head if you need. And again, try to avoid that right hip bone splaying out and bring it in towards you. That should deepen the pose. Good. One more breath. And then wherever you are, climbing back up, flat back, hands on hips. And then lifting yourself up, the strength of your legs pushing you back up to center. And we're just going to pivot to the left-hand side this time. Coming into our wide stance, toes are pointing to opposite corners of the mat. And we're going to reach the arms up overhead on our inhale, and we're exhaling to sink into those knees again. So instead of goddess this time, we're going to actually self-modify. So we're sinking into those knees. You're placing the hands so that thumbs are on the outside of the hip crease. Fingertips are coming in towards the pubis, and we're opening up, feeling that pull and open to tilt. And you'll see when you're doing this,
that you'll start to feel even more of an opening on the outside of that hip. Sink lower. Good. Try to add, rather than pushing that weight onto the big toes, try to push it onto the little toe. Sink lower, exhale, good job, breathe. Keep pulling the hands back, relax the face. For 2, for 1. Inhale to reach the arms overhead. And then exhale to pivot back to the front into your pyramid. And then just step to the back of the mat. So use that leg and propel yourself. Lovely balancing training as well as strengthening. Good job. So reach the arms up. Exhale to fold forward. Hands come down. Knees come down. Cat-cow drop, looking forward. Exhale, round the back. And then baby push-ups. Bring the elbows in for 2. Exhale for 1. Great job. Bring the knees in. Sorry, bring the knees out, big toes together, arms stretched. Drop the head. And take a moment here just to come back to the breath, to soften and to ease. Okay, so inhaling back up to center. We're going to extend that right leg forward, so bringing the hands underneath the shoulders. Right leg extends by that right hand. Okay, so we're coming into half Hanuman. If your knees feel a bit funky, you can always roll up the mat or place a blanket underneath the knee. So we're bending in that right knee. You want that knee directly over the ankle. So you're reaching up, so easy lunge, nice and tall in the spine. If you want more, moving this right foot forward and sinking into that hip space. If you're sinking, you want to start squeezing that left butt cheek to feel that opening in the front of the body. If you're here, totally fine. Just make sure wherever you are, you're imagining that the legs are scissoring towards each other rather than splaying out. Inhale. And then exhale to open twist to the left. So no closed twisting in pregnancy. Good job. Now try to keep that right knee from splaying out. And then look over to the left hand if you can. Exhale to sweep that left hand underneath you. Reach the arms up. And then exhale to frame that foot. If you have space, if not, move that right foot a little bit to the right to have space for baby. And we're going to sink onto that back heel. You can tuck the toe if you like. We're coming into half Hanuman, so this is half splits. Sinking onto that left heel, extend that right foot to flex. Drop the head. Always a nice idea if you need a little bit of support with the ground towards you or something, you can always use your blanket or a prop just to lift you up slightly and add that extra boost so you're not feeling like you're falling and stacking over your leg. And again, can you try to stop this left hip splaying out? You want to bring that in. Flex that foot. If you can, place that left hand on top of the right foot or to the outside of the right calf. And exhale, bending into that right knee. Good job. Place the hands onto the inside of the right foot and then step that right foot back into our plank modification. Tuck the tailbone. We're doing micro bend in the arms, so mini push up for 2, for 1. Good job. Next one, left leg to the outside of the left hand. Good. So then just bring that left foot in slightly if you've got the room, again for baby. And then reaching the arm up, so overhead. And then sinking into that hip if you want extra, it's squeezing that right butt cheek. Breathe here. And then exhale to twist to the right. And again, the arms are active. You want them to be parallel to the mat. Squeeze, keep that left knee from splaying out. And then if you want, look to the right. Right arm reaches underneath, looking down, reaching the arms up together. Inhale. And then exhale to frame that foot. Sink back onto the right leg. Flex the left toes for half Hanuman. And again, that right butt cheek should want to come back into the middle. And you'll feel a bit more of a stretch. Right arm can extend around that left foot or to the shin. Wherever you want to go, wherever you feel, you can just stay in your half Hanuman. Keep hugging that right thigh inwards, inwards, inwards. And exhale, sinking into that left knee. Good job. Extend that left foot back, so just inching away from the middle. Modified plank. Mini push-up, tuck that tailbone for 2, for 1. Good job, sinking onto the heels. So we're coming down into a seat now. So here are the options. Because we're going to be lying on our back, we're not going to be here for very long. And obviously, you know, it's not something we should be doing in pregnancy because it can cut off the vena cava blood supply. So what I offer is you can get a lovely big stack of pillows, stack them up. Otherwise, you can just come down into a seat and miss out this part of the practice, which is totally fine. But I have my imaginary stack of pillows here if you want, just making sure that you're lifted in some way, shape or form. If you're sitting down, that's totally fine. You can bring the feet so they're hip width distance apart. Place your pillow or your rolled up blanket in between the thighs, and we're just going to stay here and squeeze the thighs together. That is your practice now. Bring the fingertips towards each other. Otherwise, you're going to come to lie on to the pillows or onto the back if it's your first trimester, and bringing the heels towards the sit bones. We're coming into a bridge, so we're rolling underneath. So again, modified bridge wherever you can. If you want, you can just come into this bridge and you don't stay here for very long. Otherwise, like I said, you can stack your pillows, squeeze the legs together, or come into a seat, fingertips pointing in. So I'm going to show you the bridge variation today. Squeeze that blanket so nice and tight between the thighs. You want to really feel that connection there. It starts to really strengthen through the pelvic floor as well. And then roll the shoulder blades underneath, breath in. Exhale to lift the sit bones towards the sky. You can tuck those shoulders underneath, squeeze, chin to chest, breathe, squeeze, breathe. So again, strengthening the internal adductors is perfect practice to start strengthening for labor, but also relieves sciatica pain. For 2, for 1, squeeze one last time, exhale and roll down. So wherever you are, just removing that from the side. We won't be needing that anymore. And if you were lying on your back, just slowly rolling up into a seat. So we're going to meet into our seat here, coming into butterfly, bringing the soles of the feet together and lifting up through the spine. Crown of the head is growing tall to the sky, grabbing the big toes. And then exhale to slowly bring yourself down. So again, if baby's too big here, it's always nice to extend the feet out a little further. And what you want to do is you want to imagine that your heart is shining forward rather than your back rounding. So I'll just show you from this side. Rather than your back rounding forward, you want to experience that inching forward of the body to open up through the inner thigh. Breathe here. And back to center. Inch yourself up on your exhalation. Good job. So bring the knees in, just tap the feet slightly. And then last but not least, we're going to Come into my favorite windscreen white feet. So bringing the feet wider than the hips. Hands can be behind you, nice and tall in the back, and then dropping to the left. Great to open up there through the thigh. And then dropping to the right hand side. And just repeating one more time on either side. So again, just making sure that you're not slouching. You're really lifting up and nice and tall. So in yoga, where the body is always active unless we are in Shavasana, in our corpse pose. But we are always keeping everything active and strong and growing through the spine and lengthening through the body. Well, that was lovely. So let's place the feet so we're coming into a comfortable seat. If you would like to bring anything to come underneath your sit bones, to just lift you up. It's always nice to do so. And just coming to our final part of our practice, shutting down the eyes, placing one hand onto your baby, one hand onto your heart, taking a brief moment to notice a shift, a change, to let go of any expectations, of any judgment. Knowing that whatever happens, your body knows what to do, you know what to do. Taking a breath in, reaching the arms overhead, hands to heart center. On the exhale, namaste. Thanks for joining me today. It's been great. I hope this helped a little bit with your sciatica. And again, if you need anything, any more advice, just let me know, and at Lucy Bentley Yoga or here on my YouTube. Take care. Bye.